Hello friends, today's topic is diagnostic aid for dental caries. Diagnostic aids are those appliances or those instruments which is used to identify dental caries. It can be conventional or the recent advancement. Conventional diagnostic aid can be of different types like visual examination, tactile examination, dyes and radiographs. So the visual examination can be done by eyes or lens, and in visual examination we usually see color and texture, and it determines the qualitative destruction of the dentine, and the clinical accuracy is 25 to 30%. So according to ADA, it can be no caries, initial caries, moderate caries and severe caries. Tactile examination can be done with probe, dental floss or mechanical separator. Probe, we should not use sharp probe because it may lead to the irreversible damage of the tooth. So the probe should be blunt and pointed. Dental floss, we use the unwaxed dental floss which show resistance in the proximal areas determining caries. Mechanical separator, we have orthodontic band which separate the tooth and then we can detect the dental caries. Coming to the dyes, we have basically different type of dye like basic fuchsin and procyon dye, which is applied for 10 seconds in the tooth and then it is rinsed off, and the tooth which is deeply stained will be the caries. We have different type of enamel caries dyes like 0.5% basic fuchsin, procyon dye, 1% acid red in propylene blue and methylene blue. These are the different types of enamel dyes. So basically this is the conventional method which was used from very old days to detect dental caries. Now coming to the radiograph, in radiograph we have intraoral periapical radiograph, that is IOPA, bite wing radiograph and zero radiography. IOPA, as we know, it is the conventional method and the accuracy rate is 40 to 65%, whereas bite wing radiograph determines the proximal caries. So this was all about conventional diagnostic aid. So the most commonly conventional diagnostic aid used for dental caries detection in dental clinic is visual examination and tactile examination with the help of eyes and probe. Then after that, we ask the patient to go for IOPA or the dental X-ray to determine the further extension of the caries. Coming to the recent advancement, we have different type of recent diagnostic aid like illumination. In illumination, we have photai, that is fiber optic trans illumination, then diphotai, digital fiber optic trans illumination, in which we use digital charge coupled device CCD camera, and then the fluorescent camera. Fluorescent camera is vista proof, in which there are 6 blue light and there are charge coupled device. If it shows the green light, then it is sound dentine or sound tooth. If it detects red, then it is carious part. Then we have endoscopy. In endoscopy we have white light fluorescent and the videoscope. Then we have ultrasonic waves to determine the dental caries. Then we have different types of instrument to detect the electrical conductance measurement like caries meter and caries scan pro, in which caries meter, if there is green light, there is no caries, yellow light, enamel caries, orange light, dentine caries, and if it is red, then it involves the pulp. In caries scan pro, there are 2 indicators. For green light, it is sound tooth. For red light, it is the caries part is deeper. And the analytic part is from the number 1 to 99 in case of caries scan pro. Higher the number, more severe is the dental caries. So coming to the advancement in the radiographs, conventionally we used to do IOPA, bite wing, Now we have the digital radiograph, digital subtraction radiograph, magnetic resonance microimaging, then tuned aperture computed tomography. So the advantage of the digital X-ray is it is a filmless technique and there is decrease in radiation dose and it is a quick process as compared to the conventional one. Digital radiographs are faster than the conventional one and there is no need for the film and the conventional procedures. Then we have different type of laser in which the most commonly used is diagnodent. That is, the wavelength of diagnodent is 655 nanometer, and if the reading is between 0 to 4 there is no caries, 4 to 10 then enamel caries, 10 to 18 then dentinal caries, and more than 80 then the dentinal inner half of the dentin is involved. Then decay mini, it was approved by FDA in 2007, pen size lightweight instrument to detect the dental caries. Then we have dye enhanced laser fluorescence, and in miscellaneous we have intraoral tetra camera which increase the sensitivity, but the disadvantage is there is decreased specificity. So this was all about diagnostic aid and dental caries. So the MCQ of the day is floss used to detect dental caries, and the correct answer is thin and unvexed dental floss is used.